He was 69 years old. He had a checkup 3 weeks before he died. His doctor told him everything looked clean: blood pressure manageable, cholesterol acceptable, heart rhythm normal on the ECG. His wife said he seemed perfectly well that evening. They ate dinner, watched television, talked about weekend plans. He kissed her goodnight, went to bed, and never woke up. The cause of death was a massive cardiac event, the kind that strikes in the quiet hours and leaves nothing for anyone to do. His family was left trying to understand how a man told he was fine 3 weeks earlier could be gone by morning. There was no clutching chest, no moment of alarm, no warning, just the terrible stillness of a morning that should have been ordinary. At the center of it was a habit he had practiced every single night for years, one that research now clearly links to this kind of nocturnal cardiac event. A habit so ordinary that the idea of it being dangerous had never entered the conversation. I want to tell you about a second person, a woman, 64, who woke at 2:00 a.m. with her heart pounding violently. She thought she was dying. She called an ambulance. The paramedics found her blood pressure at a level that alarmed them. She survived. When the cardiologist asked about her evenings and habits, she described something she had done every night for years, never imagining it could affect her heart. When he explained it, she sat still, then said quietly, "Nobody ever told me this. Not once. In 64 years, nobody ever told me. I'm sharing these stories because I've heard versions of them more times than I can count. And every time, at the center is the same habit completely built into daily life for most older adults, yet its cardiovascular danger has never entered the conversation." The man who died was not unlucky. He died because a specific, identifiable, modifiable habit was loading his cardiovascular system for failure every single night. And no one warned him. I am here to warn you. Please stay with me. The American Heart Association has documented what cardiologists call nocturnal cardiovascular vulnerability. This is the well-established phenomenon where the risk of heart attack and stroke rises sharply during sleeping hours, especially between midnight and 6:00 a.m. This is not fringe research. It is clinically recognized reality. During these hours, the body undergoes hormonal shifts and autonomic changes that a young, healthy system manages smoothly. In older adults, where the system has accumulated years of silent wear, those same shifts can become dangerous. The National Heart, Lung, and Blood Institute explains the central mechanism clearly. In a healthy system, blood pressure follows a daily rhythm, rising during waking hours and dipping 10 to 20% during sleep. This nocturnal dip is biologically essential. It is when the heart approximates true rest, arterial walls decompress, and the vascular system performs maintenance it cannot handle during active hours. When this dip does not happen, when pressure remains elevated or even rises during sleep, the consequences are serious and well documented. Research estimates that 30 to 50% of adults over 60 experience this non-dipping pattern. A landmark study in hypertension followed more than 3,000 adults with an average age of 66 over for years. It found that those with non-dipping blood pressure had more than double the risk of cardiovascular events compared to normal dippers. Not 10% higher, more than double. And this elevated risk existed regardless of how well their daytime blood pressure was controlled. What makes this especially dangerous is that the non-dipping pattern produces no symptoms, no chest tightness, no warning. The person lies in bed believing they are resting, while pressure stays dangerously high. The body has no overnight alarm for sustained vascular pressure, and for a heart already working harder than it should, night after night, the damage accumulates silently, until it no longer remains silent. Another study in the European Heart Journal found that nighttime blood pressure was a stronger predictor of cardiovascular death than daytime readings. The older the patient, the more nighttime pressure mattered. So what is driving this pattern? Research is clear. It is not primarily medication, not primarily genetics. It is a specific daily behavior practiced in the evenings, so normal that most people never connect it to cardiovascular risk. That habit is eating a substantial meal within 2 to 3 hours of sleep. Most adults over 60 are doing everything they've been told to do, taking medications, attending checkups, monitoring blood pressure, watching sodium, trying to exercise. Doctors are doing what the system allows, measuring daytime pressure, checking cholesterol, recording ECGs, adjusting medications based on office readings. These interventions have real value, but here is the gap. Every one of them measures what your heart does while you are awake. Almost none address what happens during the 6 to 8 hours when you are asleep, horizontal, and unable to call for help. Your prescription was calibrated around your afternoon appointment. Nobody looked at your blood pressure at 2:30 in the morning. A review in the European Heart Journal confirmed this gap. Many adults classified as well-controlled during the day were actually experiencing dangerous nocturnal elevations. This is called masked nocturnal hypertension, affecting up to 30% of patients. The reason this persists is simple. A standard appointment lasts minutes. Medication, cholesterol, egg, those are priorities. The conversation about evening habits and nighttime risk does not fit. And so, night after night, the habit continues. The pressure rises. The damage accumulates in the dark. The research is clear, but no one explained what eating a heavy meal at 9 o'clock does to your heart at 2 o'clock in the morning until now. My name is Dr. Nicole Harper. I work with adults over 60 who want to truly protect their cardiovascular health, not just manage numbers, but reduce the risk of events that end lives silently at night. Today, I will show you exactly what late-night eating does to your body while you sleep, why it is especially dangerous after 60, and the biological pathways linking your evening meal to heart attack and stroke risk. Because once you understand what happens inside your body during those hours, you will never ignore it again. When you eat a substantial meal, your body redirects blood flow to digestion. The sympathetic nervous system activates. Heart rate rises. Blood pressure increases. This is called postprandial hypertension. In younger adults, it is temporary. In adults over 60, age-related changes make this surge stronger and longer. Baroreceptor sensitivity declines. Arteries become stiffer. Autonomic response is slow. The result is a pressure surge that lasts 3 to 5 hours. If you eat at 9 o'clock, pressure peaks at 11 o'clock, and stays elevated through 1 o'clock, 2 o'clock, even 3 o'clock a.m., the exact window of highest cardiac risk. At the same time, insulin rises. In older adults, insulin sensitivity is reduced, so levels climb higher. This promotes sodium retention, increases blood volume, activates the nervous system further, and triggers inflammation in blood vessel walls. Night after night, this creates a cumulative burden. A third mechanism involves the vagus nerve. A full stomach stimulates it directly. In an already stressed cardiovascular system, this can trigger arrhythmias, abnormal heart rhythms that may become fatal during sleep. Now combine all three mechanisms, peaking at the same time, in a body that cannot respond. This is the environment created by late-night eating. Not occasionally, every single night the pattern continues. And your doctor, reviewing your normal daytime reading, never sees it. In simple terms, you are sending your heart into its most vulnerable window, carrying a load it was never meant to bear overnight. The most dangerous habits are the ones that feel harmless. And this risk is not theoretical. It is measurable, documented, and clinically significant. A cardiac event at night alone, without warning, without time for intervention, is exactly what this pattern increases. Understanding this is what changes everything. Because once you see it clearly, the solution becomes impossible to ignore.